Imagine having to rush to the bathroom before your day even properly begins. During work, in the middle of conversations, or waking up frequently at night just to urinate. And at some point, you start to wonder why you have to go so many times. Is it a problem with your bladder, kidneys, or hormones? Today, we'll understand very simply what the real causes of frequent urination are, what's normal and what's not, and when your body is warning you. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist and expert in diabetes and hormones. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other reliable medical sources. Before we begin, please subscribe to the channel to get easy, science-based, doctor-reviewed health videos that will help you understand your body better every day. Frequent urination may sound simple, but it actually isn't. The cause could be a problem in any part of your entire urinary system: kidneys, ureters, bladder, or urethra. Now let's see why this happens. Often, the bladder itself is affected by infection, irritation, or inflammation. The most common example is a urinary tract infection, or UTI. Burning during urination, a sudden intense urge, cloudy or foul-smelling urine, these are the symptoms. But it's not just the bladder's fault. Sometimes the body produces excess urine, such as in diabetes when blood sugar is very high or when taking diuretic medications. Or if you consume too much coffee or alcohol, the body expels more water on its own. Then come issues with the bladder's muscles and nerves. Imagine the bladder suddenly going into spasm. This is what we call an overactive bladder. Or the bladder is unable to expand properly. Even a small amount of urine makes you feel an urgent need to go to the bathroom. Radiation therapy can also irritate the bladder. During pregnancy, the baby's weight and the shifting position of organs put pressure on the bladder. And in older men, an enlarged prostate is the most common cause. Now let's look at what symptoms often accompany frequent urination. Pain during urination, sudden intense urges, and difficulty starting to urinate. Dribbling or leakage, changes in the color of urine, all of these are important signs. Now let's look at the main causes one by one. In men, benign prostatic hyperplasia or BPH is very common. The prostate is located below the bladder, and when it enlarges, it presses on the urethra. As a result, the bladder has to use more force to expel urine. Prostatitis, which is an infection or inflammation of the prostate, can cause the same problems. Bladder stones and bladder tumors are less common, but they can be causes. If there is a kidney infection, symptoms like back pain, fever, and frequent urination are signs that require urgent medical attention. In women, infections in the genital area, urethritis, or anterior vaginal prolapse can change the position of the bladder. As a result, there is a frequent urge to urinate. There are also some other causes. Diabetes insipidus, very high blood sugar, and neurological diseases like Parkinson's or multiple sclerosis, these affect the bladder's signaling system. Now, the question is, how common is this? As people get older, overactive bladder and frequent urination become very common. Many people don't mention it out of embarrassment, but this is actually one of the most easily treatable problems if the cause can be identified. So, how do doctors find the cause? They start with a simple urine test to check for infection, blood sugar, or pregnancy. After that, blood tests are done to check kidney function, blood sugar, and electrolytes. For men, a prostate exam or PSA test may be necessary. If needed, an ultrasound or CT scan is performed to look for stones or blockages. Cystoscopy, which involves looking inside the bladder with a small camera, is done if the problem persists for a long time. In some cases, tests are conducted to see how the bladder fills and empties. Now, treatment depends entirely on the underlying cause. For urinary infections, antibiotics are used. If the prostate is enlarged, special medications or, if necessary, surgery may be required. Bladder stones need to be removed. If blood sugar is high, it is important to control it. In cases of overactive bladder, bladder training, Botox injections into the bladder, and nerve stimulation are all effective. For many people, simply reducing coffee intake, drinking water in scheduled portions, and doing pelvic floor exercises yield excellent results. Finally, remember that frequent urination is nothing to be ashamed of. By listening carefully to your body's signals, the problem can be easily resolved, and your comfort, sleep, and confidence will all return. If you too are rushing to the bathroom repeatedly, losing sleep at night, or your daily life is being disrupted, don't delay. The results are always better when you seek treatment early. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone expert. The information has been collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you liked the video, please subscribe and share, because awareness is the first step to good health.